Hey guys, it's the doc. In this week's YouTube video, we have another reaction / commentary video. This video, surprisingly, is actually the most viewed video we've had on YouTube. It has over 14 million views with like a gajillion comments. I figured I'd walk you through. There's a lot of comments, and I figured I'd kind of like walk you through what I'm thinking when I do a procedure like this. This is an amazing patient. He's an older guy who is a very avid violin player. And there was a video that I posted a couple of weeks before this video where this gentleman had a very large cyst on the back, on his upper back, kind of like at the base of his neck. And it was a really, really inflamed, angry cyst. And, you know, he's really, really nervous about not being able to practice his violin. So we basically did like a temporizing procedure where I drained the contents of the cyst and injected a little bit of cortisone, I think. I can't remember exactly what I did. Just to get him comfortable. So, you know, he didn't want anything surgical done with stitches. He didn't want to have to take care of a wound. And listen, as a doctor, you have to listen to your patient and accommodate, you know, what they're capable of doing in terms of aftercare and really what they want to deal with after a procedure. So we kind of found a middle ground that would make him feel better, you know, get him more comfortable so he could practice his violin and live his life, but without too much downtime or anything that was going to be debilitating for him functioning in the world. And the plan was for him to come back in a couple of weeks, and then we'd just check on that site, make sure he was doing okay, and figure out if there were any next steps that were needed. And that's what happened at this visit. So he came back, everything looked good with the original site that I drained, and he was good to go. Said, let's just leave it and see what happens. And I think I mentioned to him that he had these two large blackheads on his back, and I said, hey, you know, do you want us to do anything about it? He's like, yeah, sure, you can drain them out. He's a very cysty guy, so he gets a lot of cysts. So here goes. Here's my commentary. Now, before I even start, I will say, I know the video is very, very blurry. So what we do is we record these videos in real time. You know, these aren't staged in any way. So my assistant uses my iPhone and tries to do the best job that they can recording the procedure without interfering. So my assistant, I think, was kind of standing a little bit further back and kind of zoomed in, but didn't really focus it. So I apologize, as does she, but she did the best job she could. So here, these are two dilated pores of wine. These are huge ones. So basically I'm just trying to get the contents of them out, and it seems barbaric, but these are pretty big, and there's not a comedone extractor that's big enough to kind of get these tools out. So you'll hear people in the comments say, oh, you don't know what you're doing, and, you know, why didn't you use a curette, yada yada yada. Again, my patient didn't want anything really invasive done. He just kind of wanted them cleaned up a bit. So he didn't want them numbed up and, you know, me, you know, working on the area and putting stitches in and excising it, because the real proper way to treat these is actually surgically removing them. They're basically a cyst that has a very large open orifice. So here I'm just kind of getting, as I love to say, the schmutz out of these guys. And I kind of start a little further away and I'm squeezing it out. And if it seems like it is a medieval procedure that I'm doing, it kind of is, you know. I'm basically just literally exerting pressure on the lateral part of the cyst wall, trying to get maybe underneath it a little bit if I can, although it's impossible to get underneath these. They do go pretty deep, and just expressing as much of the contents out as I can. Sometimes you can actually see a little bit of the cyst wall, and I'm pretty sure in this one I try to go after it with a tweezer or a surgical pickup. So here I'm getting some more of the contents out, kind of, you know, going back and forth between these guys. And I do think that's like a little bit of the cyst wall there. Here's a comedone expressor. Trying to see if I get any more stuff out. And again, you can see that the orifice for that dilated pore is so large that the comedone expressor is actually going into the orifice. So it wasn't very useful. The way these work is if it's a smaller pore, it exerts pressure around the outside of the wall of the dilated pore, and you're able to express the contents of either the comedone or the dilated pore out. But in this case, wasn't big enough, and they don't make one bigger. So here I'm trying to figure out, I guess, you know, what I'm going to do next. And I think I'm going to try to grab it with a forceps, and there it is. Yes. So these are very slippery, and as you can see, it is a bit of a challenge, but you know, I'm just trying to get out as much as I can. I've actually seen this patient back. I saw him for a skin check, I think a year after this, and both sites were great. The original site with the large inflamed cyst was doing very, very well, and these guys were still, they hadn't filled back up yet, so that was good. As you've heard me say many times over, the most important part of any anti-aging skin regimen is using a proper sunscreen, namely one that's at least an SPF 30 and contains titanium or zinc or both. I couldn't be more excited to announce the launch of these two amazing Dr. Mudgill brand sunscreens. One is tinted, one is non-tinted, depending on what your preference is. I also have an amazing hydrating and moisturizing serum, which your skin is absolutely going to love. There's a link in the description below, which you can click to check out the products. You are going to love them as much as I do. There's also no forceps they make. That's great for picking up this kind of delicate, friable cyst content material, but we're doing the best we can, trying to make lemonade here. And you can see this is just the gift that keeps on giving. I mean, it's an endless dilated pore of liner. So I think a lot of folks at this point were expressing frustration with the blurriness and my inability to get the contents or grab the contents with the forceps. And listen, I'm just doing the best I can. Rewatching this video, I don't think there's a better way to have done it. As you can see, we're getting a lot, copious amounts of material out of this dilated pore, seemingly never-ending abyss of a pore. And looks like there's a bit of the wall there on the right-hand side of what I'm doing there. So I'm gonna try to get that, which is what I'm doing now. And a bit of it's coming out. So that's probably why this didn't refill right away. So like I said, I saw him about a year after this and he was still doing great. So I see him every year for a skin check, just, like a skin cancer screening. So he's probably due for one, I would say in the next few weeks, I think. Well, this was August, so yeah, maybe like June, sometime this summer, I'll see him. He usually pops in over the summertime. Again, wonderful, very gentle, kind, older guy, who I've probably been seeing for like over 10 years, actually, which is another weird thing for me to, seeing my patients. I was actually talking to my wife about it yesterday. Seeing my patients kind of, get older, and some of them now aren't moving around as good as they used to be able to, or aren't as sharp as they once were. As happens with time, the memories aren't as great as they were. But it's still amazing seeing them year after year and hearing about their families. And this one looks pretty good. I think I got a decent amount of the cyst wall out of this guy. Like I said, my patient is a really kind, wonderful, sweet man, and I'm glad I was able to help him out. And I hope that, that little commentary sheds a little insight into what's going through my mind when I'm doing these sorts of procedures. I hope you enjoy this video. Please respond or add any comments you like, because as you know, I do read and respond. I read all comments and respond to most comments, especially the nice, kind ones. And we have an amazing community here, which is, I would say, overall very, very sweet and very, very kind. And I enjoy interacting with each and every one of you. And I hope you enjoyed this video. Let's get it.